everyone. We are Miss Peterson's clinical group. During our semester, we partnered with the Greater Houston Health Education Center and spent the semester at the Hiram Clarke Community Center teaching classes to seniors in the area on how to utilize the RealPad. Hiram Clarke is in southwest Houston and its boundaries are West Airport Boulevard, Hiram Clarke Road, and Landmark Street. It is part of the Area C in Houston, which encompasses the central west and southwest of Houston. It has an income lower than 87.1% of all U.S. neighborhoods. The top two ethnicities are Blacks and Hispanic or Latino populations. Common language is English and spoken by 53% of households, and other important languages spoken include Spanish and African. Hiram Clarke is a small area in Area C. More than one-fifth of adults in Area C have less than a high school education, compared to one-fourth of adults in Houston. This affects health literacy because according to the Older American 2008 Key Indicators of Well-Being Report, 76% of people 50 years old and older have below basic health literacy skills. This means for this rapidly growing segment of the population expected to reach an all-time high of 71.5 million by 2030, low health literacy makes existing health conditions even more challenging to manage. With at least 80% of older adults suffering from one chronic health condition, this creates huge barriers to care, which include difficulty locating a health provider, difficulty filling out basic medical information forms, and difficulty following basic medication instructions. Our research showed us that higher proportions of Hispanic and Asian non-Hispanics in Area C have diabetes compared to the Harris County average. Our research also shows that the proportion of residents in Area C that had coronary heart disease, which was 3.9%, stroke, which is 2.9%, and heart attack, which is 3.1%, was comparable to Houston and Harris County. This brings us to our community diagnosis. Our community diagnosis states the risk of ineffective self-health management amongst seniors in Area C related to low health literacy as evidenced by high incidence of preventable health problems such as cardiovascular diseases and diabetes. Our outcome goal is that 50% of seniors 65 years and older in the Hiram Clarke area who are enrolled in the M-Search class will report an increase in confidence in accessing health information on the internet after completing 7 out of 9 of the classes between February 23rd through April 19th, 2016.
Our objective is for 20 seniors over the age of 65 that reside in the Hiram Clarke area to receive 1.5 hours of teaching every week on the use of tablets to access health information on the internet to enhance health literacy. These classes will be conducted by UT Health BSN students between February 23rd to April 19, 2016. In our planned activity, we are to teach a class of seniors the use of the tablets and introduce them to websites like the NIH Senior Health, the Medline Plus, or the Goal for Life website. In order to facilitate these activities, we use the following resources such as folders with the printouts of lesson plans and writing utensils for the students to write down their notes. And at the end of the class, they were allowed to take these folders home to review the information if they had any questions. And they also had tablets to practice on and cards with pictures of terms and definitions.
Our intervention plan for our community diagnosis is to use the M-Search program to teach local elders at Hiram Clarke Multi-Service Center how to retrieve and evaluate online health information using portable tablets to enhance their health literacy.
What we do, UT nursing students and health service workers use the process of adult learning, including step-by-step instruction, curriculum overview, illustration, and games to engage participants in educational activities. And in turn, all participants have a chance to practice handy skill during class.
We reviewed 3 articles to support our intervention. The first one is Partnering with Seniors for Better Health, Computer Use and Internet Health Information Retrieval Among Older Adults in a Low Socioeconomic Community. The purpose of the study was to measure the psychosocial influences of computer anxiety, computer confidence, and computer self efficacy in older adults. In order to do this, the adults completed a 5-week education intervention based on Bandura's self efficacy model, designed to assist older adults in retrieving and evaluating health information resources on the internet. The study stated that at the end of the intervention program, 95% of the participants reported that they felt more confident exploring and evaluating health information online, planned on using the health information received on the internet to manage their chronic illness, and had learned more about prescription drugs and Medicare benefits and would share this information with their friends and family members.
Our next piece of supporting literature is from Oasis Connections, Results from an Evaluation Study. The purpose of this study was to evaluate a standardized basic computer and internet training program called Connections that was designed for middle-aged and older adults by the Oasis Institute. As part of their evaluation, they included multi-markers such as knowledge, attitudes, and feedback from the course. The Connections training program was effective in teaching both basic computer and internet skills, with average scores of knowledge tests increasing, as well as significant improvements in computer attitudes. They found that it is feasible to provide training to older adults at community centers, and that the use of the internet can enhance the ability for older people to access information about community resources, perform tasks such as financial management or shopping, expand opportunities for continuing education, new hobbies, and employment, as well as facilitate social interactions.
The next article is examining health information and seeking behaviors of older adults. This study examines which resources older adults utilize for their health information needs and how trustworthy and reliable they find these resources. It also examines the difficulties they face in obtaining health-related information. The participants' ages range from 57 to 100, and the average age was 77.65 years. Average scores indicated that the participants trusted particular sources of health information. In conclusion, older adults have a greater amount of trust in the person with whom they are able to actively discuss their health, such as doctors and nurses, as opposed to a non-living source such as the internet and the radio. The study shows that healthcare providers should make a stronger effort in helping older adults understand the internet more and find reliable online resources that may help improve their trust in using the web.
Prior to taking the tablet class, students were given a pre-survey asking multiple questions related to their comfort level using mobile devices and accessing online information related to their health on these devices. After completion of the mSearch program, a post-survey was taken to measure if completion of the class resulted in the changes we predicted. One pre-survey question asked how often the students used a mobile tablet device to locate health information. 5% responded often, 32% responded sometimes, and 58% responded not at all. After taking the class, students were asked if they felt they were able to locate information related to their health needs online. 93% responded yes, and 7% responded no. When asked how likely they are to use NIH Senior Health, Medline Plus, and Go for Life, 80% responded very likely, and 20% responded somewhat likely. We are very satisfied with these results as it shows a big change in the students' confidence towards accessing online health information. One aspect taught during the mSearch program was how to access credible health information. The post-survey tested this knowledge by asking what the best web extension was for credible health information online. The answer to this question is .gov, and 87% of our students answered this correctly. In conclusion, the mSearch program resulted in a positive change in the students' ability to use mobile tablet devices and access credible online health information. In order to meet our objective, we would suggest a 3-month follow-up from AHEC in order to determine if there was an increase in health literacy.